All right. Good afternoon, everyone, and welcome. I'm Sean Pekarsky with Senior Market Sales on the Medicare Solutions team, and glad you could join us today. This webinar, we're talking all about Mutual of Omaha's Hospital Indemnity Plan, which actually just recently launched back in July. And I know just a couple of weeks ago, they launched additional states, giving them a pretty big footprint with this product now. And so this webinar is intended to show you really how this plan can be a fit for whether you're meeting with a Medicare Advantage client or a Medicare Supplement client. There's a need in both scenarios. So joining us today, we have Sandy Petrie. She's the sales director with Mutual of Omaha and has worked with us for a long time here at SMS. She's going to be walking you through the plan details and sharing with you some ideas on how you can position this with your clients. So Sandy, thanks for being here today, and I'll hand it over to you.
Oh, great. Thank you. It's my pleasure to be here to talk about hospital protection. It's one of our, like Sean said, one of our newest products, and we're getting a tremendous response from this product. So I'm very excited to be able to share it with you today. So let's go ahead and jump right in. So hospital protection, as you know, the average cost for a day in the hospital is just over $3,000. And in some states, depending on where you're at, it could be as high as $4,300. So it is very, very expensive, as you know, and that's why we designed this product to help fill in the gaps to whatever coverage that they might have. So let's start off with just some general definitions. So calendar year, what we mean by that is the 12-month period from January 1st through December 31st of each year. Hospital confinement, that means inpatient at a hospital for at least 24 hours because of a covered injury or sickness. Period of confinement, that begins when the insured has been hospital confined and ends when there is no additional hospital confinement for 60 consecutive days. And observation stay. So that starts at 6 hours of observation. And then if it continues past 24 hours, then it's considered a hospital confinement. So just a brief overview, and then I'll get into all the details of the plan. So the issue ages are 18 to 85. There is a guaranteed issue period of 64 to 74, which is very liberal compared to some of the other plans that are out there. It is automated underwriting, so it's just an issue or decline. There's a household discount for some individuals. It's guaranteed renewable, and there's no client ID card. We reimburse the client directly. There's no policy fee or application fee, no waiting period for the coverage to start, and then there's a 6-month look back period. So as Sean mentioned, the original release of the product was, July, August timeframe. And then here, September 24th, we just released about 10 more states. So on this map, what you'll see is the states that are in the dark blue. That means that the product is available in those particular states. If you look at the light blue, that just means that we filed the product in that state, but it's not approved yet. And then the gray states, we're not going to file the product in that state at this time. All right. So let's go on here. Okay, I want to talk about the base benefits because there's a lot of benefits in the base benefit. So for the hospital confinement, they have their choice of a daily benefit amount or a lump sum benefit amount. So with the daily benefit amount, it goes from $100 all the way up to $1,000. And then they choose the number of days that they want that daily benefit for. So days 3 through 10 or days 15, 20, or 31. If they choose the lump sum benefit option, they pick anywhere from $100 up to $3,000 for their lump sum benefit. And then also included in the base benefit is observation stay. So if they have the daily benefit amount, they're going to get 100% of the daily benefit amount selected for the lesser of 5 days or the base hospital days option selected. So for example, if they chose a 3-day benefit for their hospital stay, they're going to get 3 days for their observation stay. If they choose a 10-day benefit for their daily benefit, then they're going to get 5 days. So it's the lesser of. So they're going to get a maximum of 5 days in that individual situation. The observation stay for the lump sum benefit, if they're under observation, they're just going to be paid the lump sum benefit amount. For inpatient mental or nervous disorders, we're also going to pay for that. That is $175 per day, up to 7 days per calendar year. And we also have a benefit for pet boarding, because the last thing anyone needs to worry about when they're in the hospital is their pet being taken care of. They just need to focus on getting themselves well and out of the hospital. So we wanted to make sure that those pets were taken care of. So again, $75 per day, up to 14 calendar days per year. Now, we do have some value added benefits that are similar to some of the ones that we have on our Medicare supplement plan. So these value adds include iMed, which is our discount on eye exams, eyeglasses, and contact lenses. Amplifon, that is a discount on hearing tests and then other services. Garmin, that is the smart watches, the fitness trackers. There's discounts on those. Aloe Care, that is the in-home like fall detection devices. So a discount on those. And then Script Save RX. So this is a prescription savings program that's no cost. They will get discounts and savings on the majority of their prescriptions. There's also an app and a website that they can go to help them manage their medications. And also they can see if any of what foods might interact with the medicines that they're taking. So great value adds at no additional cost for the client. There are 9 optional riders that can be added. These are, again, optional, so there is additional cost for them. Let's walk through them. So the guaranteed purchase option. So this is great because what it does, it allows them to increase their daily benefit amount by 15%. They do have to wait 1 year. So the policy has to be enforced for 1 year, and then they can exercise this if they want to, increasing their daily benefit amount by 15%. They have 5 different times that they can exercise this right to increase their benefit amount, or up to age 85, whichever comes first. The nice thing is that the additional 15% that they're adding, it's based on their original issue age. So they're not paying a higher premium for this 15% because it is based on their original issue age. And there's also no additional underwriting. So they just tell us they want to increase it, and we'll go ahead and increase it. If by chance they cancel the rider, the daily benefit amount reverts back to the original benefit amount, and the premium is reduced to the original benefit amount. Okay, there is a lump sum cancer rider. So with this one, they pick 2,500, 5,000, 10,000, 15, 20, or 25,000. And then there is a second lump sum benefit of $600 for skin cancer, and that's regardless of the benefit amount selected for the internal cancer. This rider is underwritten. There's no underwriting on the other, even if they're in the guaranteed period, this one is underwritten. And I'll go through the health questions in some upcoming slides so you're familiar with what they are. So this coverage pays for first ever cancer diagnosis. So as you would expect, if they've ever had cancer, they're not going to qualify for this rider. There is a 30-day waiting period, and then the rider ends once both lump sum benefits are paid. So once we pay out the internal lump sum benefit and the skin cancer lump sum benefit, then the rider ends. Prescription drug rider. So with this one, It just helps them pay for prescriptions. So they select either $250 or $500. And then the writer reimburses them $15 for generic prescriptions or $30 for brand name prescriptions. And that's regardless of what the prescription actually costs. So, for example, if they have a Medicare Advantage plan that has a $0 copay for generic medications, we're still going to reimburse them $15 for that generic prescription. All they need to do is go ahead and submit maybe a pharmacy receipt or an EOB, and then we'll go ahead and reimburse them. They can save them up and submit them all at once, or they can send them in onesie twosies, however they want to do it. This is not a standalone Medicare Part D coverage, so just want to make that clear. It's not connected with a PDP plan, and it shouldn't be marketed as that. Again, it's just to help them pay for some of their prescriptions. The skilled nursing facility rider, to qualify for this benefit, they do have to have been in a hospital for at least 2 days to qualify for the benefits. And then the care in the skilled nursing facility must begin within 30 days of the hospital discharge. And then the benefit period ends with 60 consecutive days of not being confined in a hospital or skilled nursing facility. Then the daily benefit resets. So there could be more than one nursing home facility benefit paid in a year because of that benefit reset. So with this one, they choose a daily benefit of $100 up to $500. And then they choose which days they want to be covered. So they choose either days 1 through 20, days 21 to 100, or days 1 to 100. And I do want to point out here too, skilled nursing facility also means custodial care or assisted living. So typically if somebody gets out of the hospital and they need additional care before they return home, they might be going to an assisted facility for some rehabilitation. That's where the skilled nursing facility rider comes into play. Home health care rider. So this means home health care received in the home and provided by a registered home health care agency. This does require 2 days of covered hospital stay or nursing facility confinement. And the insured must have either a cognitive impairment or the inability to perform 2 of the 6 activities of daily living. With this one, the client selects a daily benefit from $50 up to $250, and then the insured will collect benefits for up to 30 home healthcare visits per calendar year. So if you're not familiar with what the activities of daily living is, they're listed here. So continence, dressing, eating, personal hygiene, toileting, and transferring. Cognitive impairment, that just means a deterioration or loss in intellectual capacity requiring substantial supervision for the protection of themselves or others around them. Ambulance and urgent care or urgent care. So the client selects either $100 all the way up to $500. And then each benefit, the ambulance, the emergency room, and the urgent care is payable 4 times per calendar year. So there's 12 times that this could be payable. The ambulance includes ground ambulance, also maybe includes water ambulance, and then also air ambulance. Urgent care is paid out at 50% of the chosen benefit amount, and then air ambulance is paid out at 10 times the chosen benefit amount. Now, as you would expect, the ambulance and the ER benefit, that can be payable on the same day because it makes sense, right? You go call an ambulance, they take you to the emergency room. So I do want to point out that these benefits are per year. So it's not a lifetime maximum for the ambulance, emergency, or urgent care rider. It resets every year. So they get 4 ambulance, 4 emergency room, and 4 urgent care every year. Outpatient surgery. So they choose either 250, 500, 750, or $1,000. There's no waiting period. And then the benefits are paid for a maximum of 2 outpatient surgeries per calendar year. There's no benefit reset for this. So it's just 2 per calendar year. And then only 1 payment per day. So even if they have more than 1 surgery in a day, the benefit is only going to pay for 1 per day. And then all we need is just documentation from the surgical center. So think about it like this: more and more surgeries are done on an outpatient basis. For example, hip replacements, knee replacements, you're in an outpatient facility and they do the surgery. So this is a great rider to add, considering that point that more and more surgeries are done on an outpatient basis. Outpatient therapy rider. So with this one, the client selects a daily benefit from either $50 up to $250, and then they select the coverage that they want. So either 15 days or 30 days per calendar year. There is a separate chiropractic benefit of 5 days per calendar year, and that's automatically included. So it's not anything that they have to identify. It's just automatically included with the outpatient therapy rider. And with this one, the benefit is paid once per day, even if there's multiple therapy sessions that occur. And those therapy sessions must be in an outpatient setting, so it can't be in a home setting. Major diagnostic testing. So they choose from $100 up to $500. There's no waiting period for this one either. And then the benefits are paid for a maximum of 2 diagnostic tests per calendar year. And there's no benefit reset for that. So again, just 2 per year. They can receive both of these tests on the same day. So, and all we would need for the claims is to have documentation from the hospital or the medical provider. So those major diagnostic tests include like CT scans, MRIs, PET scans, EEGs or EKGs. Okay, so with all of those 9 riders and the rich benefits and the base benefit, I hope you can see how this particular product can be customized and tailored to each individual and their individual needs, depending on what they have for existing coverage. Maybe they have a Medicare supplement, maybe they have a Medicare Advantage, maybe they even have an ACA plan. So wherever those gaps are, we truly feel like the base product, along with some of the riders, was definitely going to help them fill in those gaps to help cover that cost. So let's go ahead and talk a little bit about underwriting and the application process. So I mentioned there's no health questions in that guaranteed issue period of age 64 to 74. So if they're outside of those ages, there are 2 health questions. So within the past 5 years, have they been advised by a medical professional to have any medical tests, treatment, therapy, or surgery that has not yet been performed? And then number 2, do you have any pending test results? So this includes like tests from routine procedures such as mammograms, Pap tests, colonoscopies, or PSA tests. Okay, now for the lump sum cancer rider, this is the only one that if they want the cancer rider, they're going to have to answer these 3 health questions, regardless of if they're in that guaranteed issue period or not. So basically these 3 questions, what they're trying to get at is, first of all, have they ever had cancer? Have they been tested for cancer in the past, and are the tests still pending? Or do they need further treatment or evaluation? Number 2 is, have you ever been treated for cancer? And then number 3, have they ever been recommended to receive like a colonoscopy, mammogram, or lung CT scan or other tests as part of routine screening for cancer, but they have not completed the screening? Okay, now there is a household discount that's available. It's 7%. So to qualify, a household member either has an existing hospital indemnity policy with us, or they're applying for coverage with Mutual of Omaha, or and the household member has to continuously reside with the other person for at least 12 months, or resides or either married or in a civil union partnership. For the premium structure, the rates are unisex rates, it's issue age, and the rates do not vary by tobacco status. The rates do vary by state, and we talked about the 7% household discount. There's no policy fee or application fee. The initial premium options is either an automatic bank withdrawal or a credit card. And then for renewal premiums, they can do an automatic bank withdrawal or a direct bill, either quarterly, semi-annually, or annually. So to quote the product, they can do it a couple different ways. So they can use our e-app, which is on our Mutual of Omaha broker portal, which is called SPA, Sales Professional Access. So there is where you'll find the e-application. You can quote right from there, apply right from there. The nice thing about that is if you're writing multiple products with Mutual of Omaha, for example, a Medicare supplement plan and a hospital indemnity and dental at the same time, you can take all of those applications at one time, quote all of them at one time, and then it's just one signature that's required for all three applications. So we try to make it as easy as possible. The signature methods are very easy as well. It's either a email signature or it could be a voice signature. They can go to a website to sign, or we have text to sign, which that has become the most popular way to sign an e-application because it's so easy. The system generates a text message to the client, and in that text message there's a code. They just provide that code to the agent. The agent enters it into the system, and that's their signature. Another way to quote, since there's so many options with this hospital protection plan, I really like the mobile quote app. So go to the Apple Store or Google Play, search for quotes for sales professionals, and then download that app. From there, you will be able to quote the hospital indemnity plan. Our other products are out there as well. So dental, MedSup, our life portfolio of products, long-term care, critical advantage, accidental death. So it's a very popular app, and I would definitely recommend that you download that to your phone so you have that at your fingertips. Let's look at some sample rates. So here is some rates illustrating what the hospital benefit would be and what some of the optional riders would be if they wanted to add that. So let's look at age 65, and let's just look at without a household discount. So let's say that they pick hospital confinement for 7 days at $350 per day. At age 65 without a household discounts, that's $32.05. So if they want to add the guaranteed purchase option for 7 days at $325, that's $3.14. Let's say they want to add the ambulance, ER, and urgent care benefit at $200. That is going to be $4.15. So as you can see, the base benefit's very affordable. Even without the household discount, still affordable. And once you add that household discount in there, it brings it down even further. So what we're finding so far is the most popular riders is going to be the ambulance, and ER, and urgent care rider. Also the outpatient surgery rider, that's another popular one. And then the lump sum cancer, that's another popular one. I do want to point out that there is no minimum amount of base benefit that they have to pick in order to get the lump sum cancer. So if they wanted that particular rider, they could just get the lowest base plan that's available. And then they still would be able to get the lump sum cancer if they qualified through underwriting. So to submit an application, you do have to use the e-application at this time. We do not have paper applications available. So this is a screenshot of what our broker portal looks like. That is Sales Professional Access. So you just log in. On the left-hand side, you're going to see Sales Tools. And under there, you're going to see Electronic Applications. So that's where you're going to find our e-app. And then to submit a claim, trying to make it as easy as possible. The client would just need to obtain the UB04 billing form from the hospital facility. This is usually provided to them upon checkout. It does have all of the revenue codes, procedure codes, diagnostic codes within this form. If by chance they don't have the UB04 form, sometimes admission and discharge summaries also show that information and the dates of service. So they would need that, and then they would need to provide their policy number, name, date of birth, address, phone number, and their current email address. With all of that information, they can call in to submit a claim. They can use email. There is their own email box specifically designed for hospital indemnity claims. You can mail it or fax it in. So let's talk a little bit about sales and marketing. So, hospital indemnity is great to fill in the gaps with, say, Medicare Advantage plans or ACA plans. So in this example, the client has a Medicare Advantage plan that has a $0 monthly premium, inpatient hospital copay of $325 per day for days 1 through 6. Emergency care, there's a $125 copay per visit, and ground ambulance is $320 per copay per ground ambulance. So, this is ideal to fill in those gaps with the Mutual of Omaha Hospital Protection Plan. So we would recommend $350 a day for 7 days for the hospital stay. Add the ambulance, urgency, and emergency care rider at $200. And then add the ambulance, emergency care rider. So they're all in one, $200. So that ambulance, urgent care, emergency care is going to pay for the $125 copay, and it's going to pay $200 towards that $320 copay for ground ambulance. So as you can see with this, for a 65-year-old with the household discount, the premium is going to be $29.81, and the rider is going to be $3.86. So just for around $34, they're going to have quite a bit of coverage to help fill in those gaps. Now, if you have a client that is looking at maybe a high deductible G plan, the lump sum benefit might be just what they're looking for. As you know, the high G premiums are significantly lower than any of the other plans that are out there. And the majority of the costs come when somebody is hospitalized, because original Medicare is going to pay for everything except for $1,676 when they're in the hospital, days 1 through 60. However, with this high G plan, there is a deductible that needs to be met before the supplement will pay, and that's $287. So basically, if they have a Mutual of Omaha Hospital Protection Plan of $3,000 and they go into the hospital, it's going to pay that lump sum of $3,000, which they can use to put towards their $2,870 deductible and meet any of those other costs that need to be met. So this is a great little plan. And keep in mind too, we sometimes forget that original Medicare is still going to pay. So if you're looking at your Part B benefits, so that's the doctor benefits. So Medicare itself is going to pay 80% or around 80% of that doctor's visit. The client's going to be responsible for 20%. So a lot of people forget that original Medicare is still going to pay regardless if they have met or not met their deductible. We do have a wealth of consumer materials that's available. There's a point of sale brochure. There's some prospecting letters. We have a flyer on the claims process. We just want to make sure that the clients completely understand the whole process. So we've created all of these documents for you to use. We also have a social media site. It's called the Social Media Hub, which is on our website. This is a great tool that if you're not using this, I would recommend that you do go find it and use it. There are tips and tricks out there of how to post, how often to post. All of the posts that are out there are pre-approved, so you don't have to worry about getting anything approved. And it's simple. It's basically a copy and paste and go ahead and start posting on your social media site. Because what you want to do with these social media sites is not, you don't really want to sell over the social media sites. It's really intended to get your name out there associated with being an expert in the insurance industry, with these insurance products, so that people recognize your name and associate you when they're looking for hospital indemnity plans, for example. So these are just a few examples of some of the social media posts that are out there. They're very well done. And again, they're pre-approved and very easy to use. We also do have a mutual sales leader agent trip every year. And the good thing is that we've added hospital indemnity to the requirements for qualification. So for every dollar of annualized new business premium for hospital indemnity, dental, or meds up, that is going to give you a production credit. So there's 250,000 production credits required to earn the trip. And then this year, the qualification period started in January all the way through December 31st. So if you get that 250,000 incentive credit, you're going to be going to Rome in March of 2026. That is all I had. So I will let Sean look to see if there's any questions in the chat. I would be happy to answer any of them.
Hey, thanks, Sandy. Yeah, great information. There is a few questions. So one, looks like it just asking if a recording will be available. So yeah, we did record this and we'll be able to send that out. Question here, if any idea if this product will be available in New Jersey?
We filed the product in New Jersey. So we're just waiting for the state to either come back with objections and have us change a few things or approve it. So it has been filed in New Jersey.
Okay, that's good news. Question here on if a client gets the hospital indemnity plan customized to fit their Medicare Advantage plan in 2026, what happens in 2027 and following as customers change Advantage plans or the Advantage plans flex their co-pays?
Yeah, so that's a great question. And that's why we added that guaranteed purchase option rider, because we do know that Medicare Advantage plans changes their copays every year, and more than likely they go up. They hardly ever go down. So that's why we added that particular rider. So the client can, next year, if their change plans, the copays have changed, they can increase their daily benefit amount by 15%. And again, as I mentioned, the premium for that 15% increase is going to be based on their original issue age, and there's no underwriting for that. So it's an easy way for them to increase their daily benefit without having to apply for all new coverage.
Very good. And then also, this was when you were going over the claim details. Is there a claim form to help clients submit a claim?
Yeah, there is a claim form if they would like one. They don't necessarily need one, but yes, there is a claim form that's available.
Let's see. So are the rates level for life based on issue age?
Yes, that is correct. The rates are level for life based on their issue age. They don't go up because they are older.
Let's see here. And then question in regards to will there be premium increases every year, like we typically see on Medicare supplement plans?
There are no scheduled premium increases each year. In fact, we don't plan on increasing the premiums. However, we could at some later date if the claims experience warrants it, but we would have to do that for everyone in the same class so that no one can be singled out for that. Like for example, our dental plans, same kind of thing. No rate increases that are planned. I think the first change in rates in our dental plan, we actually reduced the premiums on some of them. And then the second wave, probably about 7 years later, there was a change, and that was about 2% on some of the policies. So, we have to trust our actuaries that they priced it right. So,
Okay. Let's see here. Yeah, there's several questions just in regards to commissions, and maybe Sandy too, you could speak to like just if an agent's already contracted with Mutual, right, this automatically gets added.
yes, that's correct. So whatever contract level you have for Medicare supplement, we automatically added this product to your contract at that same contract level.
Yep. And then we would have the commission schedules here at SMS, so you could reach out to your marketer, or if you want to include a chat here in the comment, I can make sure to follow up to get you the commission schedule as well. I know the commissions can vary by state, so there are some nuances there.
Right.
There's more questions coming in here. How often and how many times can you use the rider to increase benefits?
Okay, that guaranteed purchase option rider, they have 5 times up until their age 85 to increase their benefit amount.
And then this is a follow-up question to the claims form. Is there an app or client web portal to file claims?
There's not an app. There is a customer portal to where they can see policy information. They can't really upload information for the claims at this point. Something we're looking into. But the claim form is going to be on the agent portal, so you would be able to pull a claim form if you wanted to, or if the client wanted to contact the customer service number, they could email them a claim form if they would like that.
And then maybe there's a question in regards to the age that this is available, asking if it's available for folks under 65.
Oh, yes, absolutely. The issue ages are 18 to 99.
Okay, so definitely for under 65 as well.
Yes.
I think there's a question just in regards to, I think just more in general, like how does this plan compare with other competitor hospital indemnity plans, or I guess Sandy, is there anything like couple 1 to 2 things that maybe stands out? As I know you guys just launched this product recently, but from like a competitive landscape that you're seeing or hearing?
Yeah, definitely. So what I'm hearing right now is that the premiums are kind of in line with some of the other carriers. I think our renewal commissions are a little bit higher. Also, they really like that our emergency room, ambulance, and ER rider resets each year, versus some of the other competitors have just a lifetime benefit of a set number. I think it's 15 for a lifetime. So we don't have that. They also like that our skilled nursing facility is not just skilled nursing facility. It also includes that custodial care and assisted living. Definitely, again, to help out with those clients that are coming out of the hospital, but they might need to go to assisted living facility for a little bit just to get some rehab. So those are some of the things that really stand out.
Yeah, that's great. And I think the last, you may have already touched on this, but I think just the guarantee issue age range.
Mhm. So the guaranteed issue age range is age 64 through age 74. So the day before they turn age 75, they're still in a guaranteed issue period, 64 all the way through age 74.
Okay, perfect. I think that is all of the questions that I see. So yeah, appreciate everybody submitting those questions. And just seeing if there's any last minute ones here. Otherwise, yeah, we'll get the recording out as well. And Sandy, really appreciate your time and going through this information. We're excited about the product, and great to see that it continues to get approved in additional states. And hopefully, everybody on the line will find a opportunity to offer this product, and certainly good timing with AEP as well. If you have any additional questions, please reach out to us here at Senior Market Sales. We can help in getting you contracted or commission schedules, running quotes. Just reach out to your favorite marketer. Thank you, everyone, and thanks again, Sandy.
Well, thank you. Have a great day, everyone.